Hello, my name is João. I'm from Portugal. I'm a vet. Right now working in one of the Portuguese vet schools. And my area of research, my area of expertise, if I can say like that, is basically donkey dentistry. My PhD was directly related with donkeys and with dentistry. And before I'll start with some practical aspects, I would like to do the same I did yesterday. That basically is to go through some of the most interesting data or information that will allow us to better understand this part of dentistry. First of all, I'm sorry, I usually speak Portuguese, not English, so if there is something you don't understand, please let me know, okay? First question is, from all of you, who is a vet? 1, 2, 3, 4. So, and the rest of you are like owners? Okay. So I'll try to find a way to give the information being available for both, for vets and for owners. From the vets who are here, do you work on dentistry on a regular basis? Okay. Manually or with electric tools? Electric. Manual. Okay. So this is important for me because there are a lot of new data coming out, not only related with donkeys but also related with horses. And the vast majority of the anatomical aspects are similar. That tell us that those studies that are coming out from horses are available for donkeys and the other way around. For example, when I did, and I'll show you in a second, when I did my PhD and worked with 800 animals that never received dental treatment, it clearly shows us how the disorders can be affecting different ages and how you see the prevalence of those disorders through the lifetime of these animals. It is the nice thing about working with animals that never received any dental treatment. And those data are very available for horses too, because in theory, it will happen the same, okay? So basically, just a small introduction. I mainly work with, this is the map of Portugal and Spain, okay? I work basically inside the red spot there, the red circle. My study was mainly with 2 native breeds of donkeys, okay? They are very similar with the Poitou donkey. There is a Portuguese breed and the Spanish breed. They share the same geographical area. One is in the Portuguese side of the border. The other one is in the Spanish side. They are basically the same breed, but because they are in different countries and because we are in Europe, those animals belong to different breeds. Basically, these animals, they are large donkeys, very quiet animals that they are used on a daily basis by the local population for their daily tasks. So we're talking about working equids, and the nice thing about these pictures, as you can see, is none of them is using bits in the mouth. So the local population, they are so quiet, they were basically selected by the local population for their calm attitude. As you can see, the only thing they use is this head collar that you see in the picture. That is basically a nose band with 2 metal rings and a rope here. And we will see later how, for example, the use of this traditional head collar was directly related with some of the disorders I found, okay? Because it is very important for us to, when looking inside the mouth, not only paying attention inside the mouth. There is a lot of valuable information in the surrounding environment of the animal that we really should pay attention, okay? Sometimes the main cause of the dental problems, for example, are directly related with the environment and not with dental problems. I'll show you in a second. So basically, what I did during this study, I visited 86 villages from this geographical area. I was in contact with almost 350 owners, and I looked for all the mouths of this animal, and all the animals who had some kind of dental treatment, those are some of the pictures from this study, received free dental treatment. Okay, it was my personal way to say thanks to the people who let me use their animals for the study. So basically, these animals were divided in 7 age groups, okay? Almost all of them from 5 years, except the first 2 years, because as you know, there is the most dynamic period inside the mouth of these animals is between 2.5 years and 5. Because it's the time where the dental teeth, the deciduous teeth are changed by the definitive teeth. And for vets and for owners, it's very important to know because dentistry should be assumed as something prophylactic. Okay? We don't need to have the donkey to be lame or the horse to be lame to call the farrier. And here is basically the same. We don't need to wait for the problems to be inside the mouth. So we need to avoid problems. And that's why we divided in this specific group 2, that means 2.5 to 5, because we find out that there were a lot of specific disorders from this age, and we're talking about young animals. Apparently, the owners will say, my animal is okay, is young, 3 years old. But the truth is that if we're not able to solve these problems while they are happening, they will become, and most of them are developmental problems, they will become acquired problems. And an acquired problem means there's a problem that is already inside the mouth. And you saw this morning how dental problems can be so important for situations such as colic. Especially, we saw this morning that the most important thing to feed our animals is straw, for example. But if the animals, they don't have the capacity to mechanically break the straw into small pieces, that then they will be able to be digested, there is no other place in the entire gastrointestinal tract of the donkeys to reduce the size of the fiber. So it is very important that you are able to avoid the appearance of these problems, okay? So basically, we look for all the disorders you are able to look during a clinical examination. Those that are not only affecting the incisors, but also the cheek teeth, and of course a full list, those ones in the middle, that affect both different groups of teeth. I put the results in here. I don't want to go through all these results. If any one of you is interested, all these results are published right now in different scientific papers, so I'll be more than happy to send you this information by email. You just give me your emails at the end. But for example, what we did basically, we checked the total prevalence. Those were the most common disorders. Something really curious, for example, craniofacial abnormalities, overjet, overbite, and underjet was affecting by almost 50% of the population. And why? Because these breeds are endangered, and there was a huge reduction of the genetic variability. So all these disorders appear. But this also tells us that, for example, crossing animals from the same family, that is basically exactly what we're doing, reducing the genetic pool, these craniofacial abnormalities will appear. And they will bring us a lot of different problems, okay? So this is very important. For example, diastema and periodontal disease, you will see how together they go, okay? There is no periodontal disease, or there is no diastema that will not lead to periodontal disease. It is very painful. It is a very painful situation, and it's there. All the animals, they have it. But please pay attention to these retained deciduous incisors. Of course, it's only affecting less than 7% of the population. But when we look inside the age, you can see that, for example, retained deciduous incisor is an age-specific disorder. In that specific group, is affecting almost 25% of the animals. So knowing that, and knowing that residuous deciduous incisors, it is a problem in donkeys, 1 out of 4 is having a problem here, we need to be aware of that. And this tells me that we need to look after our animals since they are young animals, okay? This is very important. And you see, for example, how periodontal disease is literally increasing up to 32.3% when talking about incisors. And when we all look about the cheek teeth, it's happening basically the same. You also will see that there is a retained deciduous premolars, and they are only premolars and not molars, because it's important for you to know that there are no milk molars, only premolars, okay? The molars, when they came out, are directly the definitive one, okay? There is no deciduous version of the molars, only incisors and premolars. Even the canines, there are some milk canines, but they never erupt. And it's some animals, they have it, some others they don't, okay? We'll then pay attention, but look, almost 83% of all these animals, they have some kind of disorder affecting the cheek teeth. It is a very high prevalence of dental disorders. I have to tell you that 95.4% of these animals were never treated before. So it really gave us a clear idea about how dental problems can affect the global health of these animals. And we'll pay attention here to this cheek teeth enamel overgrowth, what it's usually called the sharp edges. And we will see later if these sharp edges are indeed a disorder or not, and that's why I put those results here, and we'll discuss a little bit about that, okay? Again, please look on the retained deciduous incisors. almost 33% of the animals present at least one cap on the premolars. It is a very high prevalence. From yesterday, they bring me 3 donkeys inside. One of them needs already to have one of the milk teeth removed. So 1 out of 3 here, randomly bring inside, one of them needs a problem of that to be solved, okay? So all the animals, they receive a dental treatment. And I have to tell you that usually I work with these animals without sedation. Donkeys, they allow me to do at least the clinical examination without sedation. And that's good. Why? Because if there's nothing to solve inside the mouth of the animal, you just remove the gag and the animal is free to go. Much cheaper than with horses that you need to sedate. But it's basically, it's not because I'm crazy and I like to risk. Donkeys, because the way they behave and the way they perceive what we're doing with them, they allow us to check without sedation, okay? Even if a donkey is very stressed, he will never react like a horse. If I put the horse inside here, put the gag on, the speculum, to open the mouth, and if the animal is scared, even if it's not something that is going to be painful, the horse will jump on me, will kill us all, and he will be 300 meters far away, he'll start thinking if it was the right thing to do. So donkeys, my personal opinion, I think they really think, they try to evaluate each one of the situations, and they try to decide if it's dangerous or not for them, okay? I am the first one looking for my safety and for animal safety. And if the animal is not cooperative, I will be the first one to sedate. Because I am working with power tools inside the mouth. And they can be very effective or they can be very dangerous. Okay? So I am the first one being sure that I'm 100% safe for me and for the animal. I work with donkeys all over the world, and the vast majority of them allow me to work without sedation. The thing is, for example, these specific animals, they are not handled like these donkeys who has each one of them as an owner, you know? So the animals are used to be handled by people, they have a relation with the owner. Sometimes, it happens to me in Mexico, so being in Mexico in the Equitarian Initiative, you have all the owners coming in with the animals. And it's very important for me to try to decide in those 5 to 10 seconds if I want the owner next to me or not. If you see, imagine a football field with 300 people inside and 300 donkeys. And you see the donkey is next to the owner, like say, hey, buddy, I know you. So that's the kind of owner that I want to have next to me. And the owner is nervous, so the animal is nervous. You start talking with the owner while scratching the donkey, and you see like usually there are young boys or ladies coming in with the animals. This is the kind of people who work with donkeys, women and children. I'm lucky enough, I'm fluent in Spanish, so I start speaking with them. You see them relaxing and you see the animal relaxing. You know, okay, stay next to the animal, I want to show you. If you see that the animal is very scared because you see the owner with a stick or something like that, you just bring the donkey inside. I don't talk with the owner, and 5 seconds later, because he doesn't know me, he sees the neighbor and he disappears, and you see like the donkey relax just because the owner is not next to the animal. Usually, in these specific situations, I always want the owner next to me, you know. There is a close relation. This old population of people that I'm working with, they have a close relation with their animals, okay? Of course, every single painful procedures that I have to do in the donkeys, I sedate the animals like horses, you know. There's no point to be doing anything that is painful for the animal. But we also know that the basic dental work, meaning balancing the mouth, reducing something that is sharp, is not painful. So the animals, the vast majority of the animals, they allow us to work without sedation. These specific donkeys that we have here, they are not handled, so it is normal that if one of these animals will not allow us, or 2 or 3 of all of them, okay? But I want you to know that it is possible. You will see all the pictures I have in this presentation. Those intraoral pictures are taken with animals that are not sedated. So the animals are quiet, and I solve all those animals without sedation. Of course, the non-painful procedures, okay? And when I started this study, I found some of very, very extreme situations like this one. Even for you, for those who are not vets, you always have to think that when talking about teeth, we need to have, the only thing I do when looking after the teeth of these animals is allowing them to chewing properly. That means they can move the jaw laterally and a little bit rostrocaudally without any mechanical barrier. You don't need to be a vet to understand that, for example, these 2 lower 6s, they are working as a mechanical barrier. If the animal wants to move the jaw backwards, and if those structures are here, they are blocking, okay? So the only thing I'm doing when working on dentistry, I try to remove each one of the structures that are abnormal in the mouth, and that they will avoid my animal to be comfortable eating. If the animal is comfortable eating, the animal will be comfortable riding, jumping, doing dressage, whatever he wants, okay? Then there are some anatomical particularities that we'll talk during this small presentation. Of course, we use all kinds of different ancillary diagnostic tests. Every time we need, for example, X-ray is very useful. This is a synoscopy. This is a histopathological preparation from a mass that you remove from the mouth. That's a rhinoscopy. Well, and of course, we have all these clinical signs that will tell us that the animals, they have dental problems, like dropping the food or smelling out of the mouth. But please don't only concentrate on the mouth of the animal. There is a lot of information that you can have and you can obtain from the surrounding environment. For example, animals with diastema, this problem here, diastema is no more than the space between two teeth, will accumulate food. And the animals will do something that is called quithing, meaning that they drop the food out of the mouth. But if you have 1 or 2 donkeys, and even if they drop the food, you put the food in the night, and you go there 12 hours later. You put it 6 p.m. in the afternoon, and you go there at 6 a.m. Even if the animal is dropping food, a lot of these animals will re-eat that food. So you don't see these small balls of half-chewing food around. So you'll never know that the animal is dropping food from the mouth. So, of course, you have signs like this, like nasal discharge or loss of body condition score that are animal-related. But for example, if the animal is dropping food on the place they drink, you will see that food in there. So that information is coming from the environment of the animal. It's not coming from the animal. The animal dropped the food while the animal is going to drink. So in that specific moment, you see that the animal is dropping food, okay? Of course, this is also from you see here the animal is quithing. It's like a squirrel or a mouse. When they keep the food in here, basically what they are trying to do, they are trying to protect the soft tissues from the dental abnormalities, okay? So what is causing the pain in the mouth is the contact between the soft tissues and the abnormal structures in the teeth that are affecting those soft tissues. So what the animals do, they keep the food in there, and at the beginning is really helping. But then what's happening is that there is happening fermentation of that food inside the mouth, okay? So, and it will start producing, the bacteria will start producing acids that will destroy basically the tissues, okay? Or these two situations here, what do you think is happening here? What do you see and what do you think is happening? Because of the bit, you say? Yep, here for example, you see, the lip is cut because of the bit, and the same here in this tongue. So I can be the best dentist in the world. I can solve all the dental problems. If I'm not able to identify this and mainly identify the cause that is what is causing this trauma, and I leave the animal like that, I'm not doing anything. Okay, so we have to try to identify, actually, this was caused by this. Okay, so for me, it's not enough to say, okay, there's something wrong in the mouth. We need to look for the cause of the problem, and we need to find solutions. In the vast majority of these cases, these animals, they are so traumatic about the contact that even if you don't put anything, you just put a small rope, they will respond to the pressure. Okay, or like for example, this is in Morocco they use this kind of bit. It's like a ring all around the jaw. I saw animals with a broken jaw because of that. Okay, so it's the kind of things that you need to look for solutions. Here, for example, what do you think is happening here? You understand the picture? That's a tongue. Okay. It was in Mexico. I called the owner. I showed the tongue. He says, "Yes, I know." He said to me, "Yes, do you?" "Yes, yes. It's because of the leaves of the corn, but it's the only thing available that we have to feed our animals." Okay, at least he knew that was a problem. Of course, here there is no apparent solution because it was a specific time of the year where the only thing available to feed the animal was that. So I show him the problems. I use this animal to show to the other owners this problem and tell them, please, when it starts raining, when you start having grass, please move the animals out of this because you can see the result. Here is the kind of thing that there's nothing you can do. okay? Chronic lesions due to the close contact between a very rough and abrasive diet with the soft tissues. But here, for example, what do you see in there? This is a supernumerary tooth, okay? A supernumerary tooth means that sometimes animals can have more teeth than they should, okay? And what happens is that usually the supernumerary tooth are displacing the normal teeth, are causing diastema in between the normal teeth and the supernumerary teeth. That diastema will lead to periodontal disease. And because these teeth are usually not in full contact with the opposite teeth, you never forget, you can never forget that the equine teeth, it's one tooth against the other. And they have a continuous wear process that is followed by a continuous eruption process. So what is called the clinical crown, that is the part of the crown that you see, it's always at the same size, but because there's this continuous wear, there is a continuous eruption. So for example, this tooth is suffering a continuous eruption. This specific part here is in contact with the lower cheek tooth, but not this part. So if you look here, we have exactly everything. Because this is a supernumerary tooth, this normal 7 is displaced laterally. Because it's displaced laterally, it's damaging the soft tissues in here. You can see all the food entrapment, meaning there is a diastema in there. If you remove and clean that, you will have periodontal disease. And because this is a sharp structure here, it's cutting the tongue. Okay? Something very important, in my PhD, we did a specific study about the presence of supernumerary teeth, and the conclusions were very, very interesting. First, they come late in time, meaning that it doesn't matter if it's a horse or a donkey or a mule that you check on a regular basis. Always, but absolutely always, count the number of teeth. Because it can happen that after 10 years of looking after the same animal, suddenly you find they erupt late in time. Usually, you will find them, what it's called distal molars, mean in the very back, it should be the 12th position, distal molars, maxillary and bilaterally, okay? That is the most common position of these supernumerary teeth. Another important thing can be hereditary components. Okay, so we found animals that were directly related having exactly the same supernumerary teeth. Okay, sometimes it is very difficult to count teeth, so it's much easier to count interdental spaces. If we have 6 teeth, we'll have 5 interdental spaces, meaning that if we have 6 or 7 interdental spaces, we for sure will have more teeth than normal. Not only have to count the teeth, but also have to check the size of the teeth, because you can have, I will show you in a minute, some cases that we have 2 teeth that went together, so we still have 6 teeth, but one of them was double size. Okay? I'll show you in a second. And can you tell me what's going on in there? This is going back to our retained deciduous teeth, and how a simple problem that was not solved when the animal was young led to a lot of acquired problems. What you see in here is a small fragment of the retained tooth, okay? Because the retained tooth was in here, the definitive tooth erupts in a different position, okay? So now we have a diastema here and a diastema here. Why? Because this tooth is not inside the incisive arch. More than that, because the food was entrapped between both teeth, the milk one and the definitive one, we have a caries in there. So that tooth is half destroyed. And apart from that, this small piece, in the meanwhile, this broken retained tooth was broken. And we have a small piece of root that is retained there that is basically acting as a foreign body. So because we're not able to check this animal when he was between 2.5 and 5 years old, now we have a lot of acquired problems, okay? This is something I do during my clinical examination. I do what I call manual nocessive tests, meaning that I press in 3 different areas of the face, I press the soft tissues, trying to obtain a painful response. So basically what I do is I press the cheeks against the cheek teeth, okay? If the cheek teeth are sharp, the animal will respond, of course. They move away from the pain. And it gives me a lot of good information. Of course, it can be only a scary animal that just because I do that, they will move. So I move my hand to a place that I know that is not painful and I press. If there is a negative response in there, but when pressing the cheeks against the cheek teeth, the animal responds, it can be a good indicator that the animal is having some problem there. And this is something that you can do at home. We use the fact that the mandible, under physiological conditions, the mandible is narrower than the maxilla, what is called anisognathia. So I can go here and press, okay? And please remember this image, because remember that I told you about the sharp edges? We will need this image to understand something. Then, because of the fact that the tongue is like a mushroom, when you cut the tongue, it is this mushroom appearance. If I press the base of the tongue and I stimulate the contact between the tongue and the lower cheek teeth, if it's sharp, the animal will complain. And then the other thing I press is the temporomandibular joint. Never forget that the TMJ is the only functional joint in the entire head. So if the animal is not comfortable, for example, chewing on the right side, he's going to start chewing more on the left side, and sooner or later, usually sooner than later, he will start complaining about the left TMJ. Okay? Apart from that, when doing dental treatments, please never keep the mouth open for more than 1 to 2 minutes. Never. 1 to 2 minutes. That's my personal opinion. I'm going to tell you why. I start working with this. After 30 seconds, this disc is full of dust. So I have to stop anyway to wash the disc, because it stops being effective. So there's no point, every time you go to the dentist, and the dentist asks you to flush your mouth, he's not actually asking you to flush your mouth. He has a tube in there that is sucking. What he wants you to do is to close your mouth and to move the jaw so you can massage a little bit the TMJ. It's basically what the dentist is asking you to do. And this is exactly what we need to do to our animals. Just close a little bit the mouth, let the animal to rest a little bit, avoid the pressure, and restart again after 30 seconds. At the end of a normal dental procedure, that probably will mean 1 or 2 minutes more. But it can be, especially in old animals, or in animals that they were sore when we press, or in animals that they have terrible mouth, and the temporomandibular joint is not working properly, that can mean the difference between the animal start eating right away when we finish, or stay 2 or 3 days without eating. And you learned this morning the meaning of a donkey without eating 2 or 3 days. Hyperlipemia, and the animals are dead. Okay, so it's just a question of being conservative. You know, there's no point to keep a mouth open for more than 2 or 3 minutes, let's say 3 minutes. Don't leave a mouth open for 15 minutes, 20 minutes. Even if they're sedated? Even if they are sedated. I use very low doses of sedation, even in horses. So I use the enough amount of drugs to keep the animal calm, but to give me information. If I put the animal literally knockouts, even something is very painful, the animal will not react. So I want to know that, for example, I think there is some degree of mobility in a tooth. When I grab the tooth with my fingers and I move it, if it's that painful for the horse, I want to see a painful reaction. You know, I want to get information from the animal. You know, that's why we work with living animals. You know, I want to have information from that animal.
If you're doing extractions, do you take a break every 2 minutes?
If I have to do an extraction, usually what I do is then after, when I put the extractor on, I close the gag and I leave it with only 1 click. Okay? Then I leave it with 1 click and I work, I try. Yeah, so you open the mouth normally. Like usually I use for those who doesn't know, to do an extraction, what I need to do is, for example, if I want to extract one of these teeth, I need to use what is called a spreader, meaning that I will put something in between this interdental space, trying to force. The tooth is supported inside the alveolum by something that is called the periodontal ligament. Okay, the periodontal ligament is stronger than iron, but it's very elastic at the same time. So it's composed of millions of fibers, and you have to break each one of those fibers so we can remove the tooth. So what we do some pressure here, we leave it like for 5 minutes. Then you move to the other interdental space. In between, you close the mouth. 2 minutes, okay? 2 minutes. Go back, put 5 minutes more. And then when you grab the tooth with the extractor, you close it, so you keep the mouth, something like this. Instead of keeping it like this, you keep it like this. And you start working, because then you cannot stop. This is the extractor, okay? And what we have to do, we start working like that, no more than 20 degrees, because we can break the tooth. And if we break the tooth, we lost the only anatomical structures that allows me to extract the tooth, that is the clinical crown. So we start working like that, and it can take us 1 hour, 2 hours, depends on the age of the animal. In very young animals, for example, imagine an animal that from the entire tooth there is only an apical infection, but all the surrounding areas are healthy. It can take you 2 hours to extract a tooth, so you really need to be conservative. Close it, stop it, wait 2 minutes. It's impossible to be 2 hours with your hand like that. After 5 to 10 minutes, you feel tired, you have to stop. So the take-home message is please be conservative. Never forget about the TMJ, okay? And here you can perfectly see, you see the sharp structures, you see the ulcers, and it's easy to understand if you press the cheeks against the cheek teeth, the animal will react. And it gives me a lot of useful information, like if the animal is complaining, I will be very careful when opening the mouth. Because even if those ulcers are not there, but these sharp structures are in there, if I suddenly open the mouth fast, I can be responsible for those ulcers, okay? So it's just trying to obtain the maximum information as possible from outside before opening the mouth. And this is, of course, it takes a long time to explain, but it's something that you do in 2 minutes, you know? Like check the symmetry of the head, looking at the nostrils, smell the nostrils, try to understand the smellings coming out of the mouth. Everything is once you get used with this, it's something very fast. But at the same time, especially with the donkeys that are not sedated, you're establishing a link with the animal. Touching, feeling, having the animal next to you. At the same time, you're scratching the animal is going to lower levels of stress that allow you to work, okay? And curiously, it was a study. Basically, we did these 3 tests, and you can see how, for example, this is the cheek. So with 2 groups of animals, 2 of them received treatment. One group received treatment, the other don't. And look, the pain response went dramatically down just because we eliminate the structures that were responsible for that pain, okay? I put this picture on purpose because you will see people grabbing the tongue while working, okay? I never touch the tongue of the animals, never. First, this is, you see, grabbing the tongue is in contact with the teeth on the right side. But look how the teeth on the left side are. So just by doing that, I can be responsible for cutting the tongue on the other side. Apart from that, if the animal suddenly moves, and even the sedated animals can move, and I don't follow that movement, I can be responsible for damages here at the base of the tongue, or even worse, for a fracture of the hyoid bones. So never ever touch the tongue, okay? Especially with unsedated animals, they will move the tongue apart. And in those horses that are not heavily sedated, they will still move the tongue. So there's no point for me. If you have a good source of light, and that is something that is really, really, really important. If the entire mouth it's with a light, something like this, when having a good source of light like this one, you don't need to touching the tongue because you can see everything from inside. Okay. And it's just, even when working, I work with this equipment, basically keeping the equipment in my mouth like that. Even if I need to move the tongue apart, imagine I can just do like this, or working in the upper. So it's like using a pen, okay? You need to find a position for yourself to be comfortable working. I have days that I'm checking the teeth like sometimes 20 animals a day. You need to find a position for you to be comfortable. And it needs to be fast and efficient. Otherwise, at the end of the day, you will not finish the work, the animals will not be happy. So, another important thing, of course, we have to flush the mouth of the animals when washing. Please be aware that donkeys, they can have very different reactions with water in their mouth, okay? So, you will see animals, when flushing the head, reacting like that, okay? Panicking, blocking the nostrils, like you see in here. So we scope a couple of animals, and basically what is happening when you flush the mouth with water, they contract the soft palate, meaning that they are moving the palatopharyngeal arch forward, and they collapse the entrance of the trachea. So if it happens, nothing serious, just leave the animal alone for 10 to 15 seconds, okay? And if after 10 to 15 seconds they are not start breathing from the nostrils, just a small massage in the epiglottic area, they will swallow and it's soft, okay? It can be a very violent reaction. I saw donkeys that jump on me with both hands just because it's like they're drowning, okay? It's blocked and they're like drowning, so please be aware of that. Donkeys in horses, you can keep the mouth open, you can flush the entire mouth without any problem. In donkeys, not all of them do that, but please be aware that it can happen, okay? And then, when it's time to work, of course, you have manual techniques and electric techniques. My personal opinion is, if you don't know, I always said this to my students, it's a kind of joke, but it's true. If you don't know how to ride the bicycle, don't buy a motorbike because you're going to have an accident. And it's basically the same. If you don't know how to rasp manually, and we can have a lot of efficient hand pieces, okay, especially those ones with tungsten. I don't like these ones, okay? These ones are not good, but these ones are good, okay? My advice is that you should choose hand pieces not with rounded cables. Okay, and I'm going to tell you why. Take this, please. If I put my hand like that, you don't know the position, okay? Suddenly while working or the animal just move, you don't know the position. If we use a flat cable, it will always tells you where you are, okay? That's a flat cable. You will know for sure if you are like that or like that, okay? And the nice thing about the flat cables is that I believe they are not made for that, but sometimes you need to find some new angle to work. So if you do something like this, you can bend a little bit, okay? And it will help you, especially these thinner ones, it will help you, you can bend them a lot, okay? And sometimes there is a very small sharp point at the very end that you're not able to reach with any of your hand pieces, and you just slightly change, and with that you can cut, okay? Please be aware that sometimes the manufacturers, they send this separately. The hand rasps, they should be pointing outside. This is a triangle surface, so you go in and you rasp from outside. I saw some colleagues of us that just put it on the other way. So they were rasping inside, okay? And actually I realized that because he said, all the horses I check are bleeding from the mouth. Regarding the electric tools, this is something very important. What is that? Is not here. These discs are usually a traumatic, okay? Those are diamond discs. Even if you put your finger in there, nothing happens. Meaning that even if you touch the tongue of the animal, nothing happens. But they go very hot. So please never stop more than 3 or 4 seconds on the same tooth, because you can burn the pulp of the tooth, okay? And the bad thing is that if the farrier cuts too much in the hoof and it starts bleeding, the owner will say, your fault. If you burn a pulp, probably the animal can have a pulpitis in 2 years, 3 years, 4 years, 5 years, or in 6 months. So there is no direct relation between something that we did wrong and the clinical symptomatology in the animal. So you see a lot of people working very, 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 very hard on the same tooth, removing just too much, okay? A small trick, for example, when I need to remove a little bit, I know that I have to work like 2 or 3 seconds in the same tooth, I put it in water. So it's cold, it's wet, and it's not getting so hot, okay? Just small tricks to work with this system. So basically, when doing, doesn't matter manually or electric tools, the only thing I want is to allow the animal to do this. This is the normal shoeing movement. The animal moves the jaw down and laterally, close it, and then this is when the animals are shoeing, okay? So basically is these movements. Open and going down, going laterally, close it, and coming back, and then to the other side. And when I finish the dental treatment, what I do, I need to press the lower jaw against the upper jaw, and I need to move both sides, and it has to be like a grounding sound, okay? The tooth surface, they need to be rough, okay? So if there's no work to do, don't invent work where you don't have to work. You need to leave a rough surface, okay? And sometimes with these electric tools, in 5 seconds you can remove all the sharp points of an occlusal surface, okay? So they are very effective, but again, they can be very dangerous if someone stays for 1 minute rasping in the same place, okay? So this is the movement. So look at this image. If there's nothing to do in the occlusal surface, don't go to the occlusal surface, okay? There are some sharp points to rasp in here, so we just rasp on the sharp points, okay? In a case like that, it's obvious that is something that should not be there, okay? This is the typical situation in cases of overjets, okay? So meaning that the rostral part of the upper six, instead of being like that, is basically like that. So the rostral part is not in contact, is not in wear, so we have this piece here that it's blocking. And it's clear that this is damaging the soft tissues, okay? So it's clear that we have to remove. And my question is, how much do we have to remove, okay? And the answer should be not how much. So people usually ask me, how much do I have to remove, okay? So how much can I remove? And the thing is, how much do you really need to remove? Being sure that we are not exposing the pulp, okay? For example, in this specific case, and especially because, if you remember, I told you that these teeth, they have an eruption rate of 3 millimeters every year. These structures are at least 3 centimeters, so it's there for 10 years. It's there for 10 years. This is a donkey. Suddenly, we just eliminate this structure, and the animal is not used to it without that structure. And again, we can have an animal that stops it for 2 or 3 days, and we go back to this morning hyperlipemic situation. So if I know that this sharp structure is damaging the soft tissues, I will round it there, reduce it step by step, step by step. And you're going to understand why. For example, in this case, what is called a shear mouth, we all understand that these structures are damaging the soft tissues. You can see there the ulcer, okay? We will never be able to put this mouth back in place, okay? But it's something very important that you have to know. This is a normal mouth for an abnormal head. These animals, they have an asymmetric head. So this is only the consequence of these animals having an asymmetric head. So the question is, if we put these teeth like they should be in a normal situation, we'll have some normal teeth, but in an abnormal head. So probably the animal is not having the contact. This is the same case after 6 dental treatments. So we were able, step by step, to at least give some comfort to the animal, okay? I will show you in a second. This is a shear mouth. So if you look the palate, in this size, you have the palate like this, and in this size, it's different. So this animal, they have an asymmetrical head. So having an asymmetrical head, please don't forget that the bone is what gives the support to the teeth. So if the bone is like that, the teeth comes out like that. If the bone is like that, the teeth comes out like that. So basically, if you look here, you can perfectly see the hard palate and how different is in this side. So the shear mouth, it is a consequence of an asymmetrical head. When solving these cases, you need to be a little bit aggressive, eliminating these sharp points, and you need to be conservative on the good side, because it's the only side the animal is eating. If you are too aggressive in here, the animal stops eating from both sides, because this one is not effective anymore. So if you affect somehow the good side of the mouth, the animal will stop eating. So please be very conservative on the good side of the mouth, okay? And answering the question, how much do I have to rasp? These black spots correspond to what is called the pulp horns, okay? So basically, the teeth, they have a pulp chamber, a pulp cavity, and we have different horns that comes to the surface, okay? And basically, these black spots, they are no more than what is called secondary dentin. There is a physiological mechanism for the tooth to protect the pulp cavity. So because of the wear, there is a constant wear, and the odontoblast, there are some cells that belong to the teeth, are receiving information and say, okay, we need to produce secondary dentin, avoiding the pulp to be exposed. But, and this is basically a 3D image. Someone did recently some studies, and they made micro CT of these teeth, and inside the same teeth, the same tooth, you can have pulp horns that are separate from the surface only 3 millimeters. And inside the same tooth, 1.5 centimeters. So something like here. This number 4 was far away from the occlusal surface, almost 1.5 centimeters. And number 2 was only 3 millimeters. Meaning that if I rasp more than 3 millimeters in that specific area, I will expose the pulp. And we'll never know, because they do this like extracting the tooth, putting into a CT machine and having this image. So because we're not going to have this information, what we have to do is be conservative. Okay? That's the conclusion. Be conservative. Look this image, for example. This is the pulp horn, this is the secondary dentin, and you only have 7 millimeters. Okay? But this is not only valid for this reduction, but is also valid when we decide to open the diastema. A diastema is no more than an abnormal space in between teeth. They were supposed to be close together. So when you have what is called valve diastema, like triangles like that, where the food is being entrapped, there is a new technique that says we can open the diastema. Yes, indeed, we can open. But please never forget that reducing here, we can also expose the pulp horns. And this study tells us that the rostral pulp horns are more distant from the interdental space than the caudal pulp horn. So if I have to work between 6 and 7, I need to reduce a little bit more from the 7th vertical surface than the 6th. Okay? Just an example, but please be conservative. Okay? It is very easy in that hook situation to cut 3 centimeters of the tooth. If I cut 3 centimeters, I will reach here. And apart from that, that is even worse. These electronic microscope images, do you know what this is? This is, so these odontoblasts, these cells that produce the secondary dentin, they have these elongations to the occlusal surface. And these are basically mechanical receptors that work on pressure. So when the tooth is under pressure, chewing, for example, it will give information to the odontoblast saying it's time to produce more secondary dentin. Curiously, those teeth that we are going to cut or reduce are not receiving any pressure. So they are not putting there the secondary dentin. So the chance that we expose a pulp horn in a tooth that is not in contact is even bigger than in a normal tooth. So please be aware of that and be very, very, very conservative when reducing these situations. Okay, so here, just round it a little bit and do it step by step. Okay? For example, in this case, it's even worse. Why? Because of this focal overgrowth in here that is in contact with the lower one, this tooth, because of the incorrect orthodontic forces, is displaced rostrally. So we have a diastema in here. You see, because we allowed this structure to appear because we're not correcting this animal on a regular basis. Now we have a diastema. Sooner or later, we are going to lose the 6th. But that diastema is between 6 and 7. So in time, the 7 is going to be also affected. Okay, so it is very important to don't allow the animals to reach these specific situations. Okay, you can see more diastema, and you can see, with the mirror, you can see the space, and you can see on the other side, the food entrapment in there. And you can see how diastema will lead to periodontal disease. That is one of the most painful disorders in the mouth. Okay. Some animals, they don't even allow to ride because they have periodontal disease, and it's so painful that they don't want anything to be in contact with the mouth, okay? And it was basically, for example, this case, all the teeth were there, okay? Every time if you have a wound, what do? You flush the wound, you clean the wound, and you make a good examination of the wound. Inside the mouth is exactly the same. You cannot say what's going on in there if you don't remove all the food. After removing the food, you have this situation with all the gum retraction, and it was 10 minutes later. So all the teeth were completely lost. They were attached in place because there were a huge amount of food keeping the teeth in place. After flushing and removing that food, all the teeth start moving and all of them were extracted. Okay? No, I'm just saying this. Here probably it took like, I don't know, 1 hour, something like that. But they were really loose. Really, really, really loose. The only one that was not loose was this one, but at the end we need to remove. It's a dank, you know, they just live with that. It's absolutely amazing. The animal was not thin. The animal was eating, you know.
I mean, what came first? What was wrong with his teeth in the first place that allowed the food to come up?
Looking at these teeth, what I can see here, there is a huge amount of calculus, okay? And calculus is usually, the deposition of calculus tells us that the chewing movement is not the correct one. Right. So the animal, the way these animals have to brush their teeth is allowing the food to circulate free inside the mouth. The forage together with the saliva. So when it's not happening, you start having the position of calculus. So probably it was this calculus was secondary for cheek teeth problems. That this calculus allows the food to be entrapped, and because of the fermentation, you have. But you never know. You just found it like that, and you try to solve it. Okay. I just want to go here and stop in this cheek teeth enamel overgrowth. Okay. This is my personal opinion. This anisognate, and then we'll see an animal. But this anisognatic physiological characteristic that equids they have, I believe it's because of this mastication process, so the chewing process. They really need to move the jaw laterally, so they need to close. This difference in horses is 23%, meaning that the maxilla is 23% wider than the mandible. In donkeys, it goes up to 30%. And for me, it tells me that because donkeys come from a desertic area, they need even more lateral movement to properly chewing the leaves or the dry forage that they will find in their natural environments. So the thing is, my 800 animals in my study, you will see authors saying that because of the domestication, these sharp edges, the number of sharp edges increase. I agree. Animals eating concentrated food, they do a vertical mastication process. It helps, of course. But these animals, these donkeys, they spend all day outside eating grass. During the night, they receive straw and hay. And 73.13% of them have sharp edges. Curiously, only 6.3% have ulcers related with that sharp edges. All of them in this area, exactly where the ring of the traditional head collar is. So my personal opinion is the sharp edges in animals, horses or donkeys, that are in physiological environments, eating grass or having access to straw, those sharp edges should be there. The animals need that to break the food. But unfortunately, they are not compatible with the tools we are using to drive animals. Head collars, etc., etc. If you think a normal head collar, this lateral part is exactly in the same place where I'm pressing the cheeks against the cheek tooth to simulate the pain. So I think the animals need those structures, but are not compatible with the modern utilization of donkeys. It's coming out of this data, you see. This ulcer is directly related because of that. So I think we need to remove those sharp edges, yes. We need to be very conservative because every time we rasp the teeth, we are eliminating a little bit of the normal life of the tooth. So the take-home message is literally be conservative, okay? And I don't understand those concepts of performance dentistry or, for me, the animals, they need to move the jaw properly, free of any mechanical block. From there, if they are eating properly, they will be in a good body condition score. They can ride, they can jump, they can do whatever they want. Okay? Those beat seats, thinking that there are pulp horns that you expose so easily, doesn't make any sense for me to be creating beat seats. Especially because if you are a good rider, the beat will be at least 5 centimeters in front of the cheek teeth. So why do you want a beat seat a place where you want to sit the bit. If in normal conditions, it will be like 5 centimeters in front. Okay, it's just probably because I'm working with donkeys, this is my personal approach, you know, but I'm doing the same on horses. What I'm applying here, I'm doing in horses. Now there's only some images of those supernumerary tooth that I show you. This is the normal location, okay? In the back, here, bilateral and distal molars, okay? Now, remember that I told you about counting the teeth? For example, this animal, 1, 2, 3, 4, 5, 6, they are in there. But look the size of that 8 here, compare with here. So that was a partial division of a tooth. So not only please count the number of teeth, but also check the size and the shape, okay? And it was an extreme case. On the second arcade, there were 3 supernumerary teeth, okay? You have the 5 interdental spaces, 1, 2, 3, 4, 5, 6, so meaning this is the 11, and then 3 more, okay? They are there, and all of them with diastema, with periodontal disease, etc., etc. Okay, let's bring a donkey, and let's see how they react. Any question, any doubts? Can you grab here? Okay, this is not the correct extractor, but this is a fulcrum. You only use it at the end, okay? And usually I don't use this one, but basically.
Pretend it's an extractor.
Yep. You grab it like that, and once you grab it like that, I just start doing this very fast.
Okay.
You know, no more than 20 degrees, and when it's really loose at the end, maybe you can do like
Fold.
a little bit more. Like, you know that you feel, when you're doing an extraction, and you see like blood coming out, but like, I don't know the English expression, but it's very typical. It's like when you take a shower from, how do you call what came out of the shampoo, you know, I don't know.
Well, you see a little trickle of blood?
But it's very typical. It's like, I really don't know the English.
Clots?
It's like bubbles, it's coming out like bubbles. So in that moment, you know that
You're getting there, and
the
you
person,
can usually hear it.
Yep, exactly. It's because the tooth is inside that blood.
You're just doing this at first.
Yep. Yes.
But that didn't break. You broke down the periodontal ligament.
You need to break.
Previously with the
You need to no. The spreader helps you. Okay. The spreader. For example, if you need to extract a 7, for me the 7 is the most difficult tooth to extract. 7 and 10s, especially the 7s. You know why? Because you cannot put the spreader between 6 and 7, because before you get the 7 loose, the 6 is already loose because there's nothing in front. So if you put the spreader here, before you have the 7 loose, the 6 is already here. It's not happening the same in the 11s because of the curve of the mandible. So you only put it in here. It takes a long
and that
time.
just gives you space to work with. That's why you're putting
Exactly. You try to win a little. So the technique is you need to it helps you to break, of course, the periodontal ligaments a bit. The spreaders, you just put it in there. I put it in there like 5 minutes, or 2 or 3, depends. Just leave it. Coming to this one. So I'm always jumping from one side to another. Usually I put a piece of rubber here, so you don't have to be doing this. You know, you put the spreader in there. Imagine this is, and then you put it with a rubber, and you just leave it. Okay, and it's doing continuous pressure, and suddenly you realize that it's not doing anything, so you just change to the other one. When you have the spreader to be closed in both sides, for me the spreader is done. You don't need the spreader anymore. Okay. Sometimes at the end, when it's really loose, I'll put back the spreader again, and now I force a little bit from both sides. But then you just grab it, and literally what I do, I start like that. No, you know. And it can take you an hour, depends. Just going, and because it's very tiring to keep you keep it like this and you come here. And because it's rubber in here, you can rest your hand, you grab the jaw, and you do like that. Okay? You need to find a comfortable way of working. An extraction can take you 3 hours. And the worst thing that can happen is like you lose your patience after 2 hours and 55 minutes. So in the last 5 minutes, you ruin because it's like, okay, I'm tired, and you do like that, and you break it. So
like for a carnivore extraction, they teach you like long, steady pressure And is that because it's a different type of tooth, and that's why we're doing the rock and
Mm-hmm.
rock and horse? Okay.
It's much stronger. The periodontal ligament in horses is much stronger than in carnivores because it's something that needs to receive pressure 18 hours a day if necessary. And the thing is, for example, extracting these supernumerary teeth, it's more easy because they are not in contact, so the periodontal ligament is not that strong. In a normal, for me the worst one is like you have an apical infection in a 6-year-old donkey or horse where only the apical area is infected and all the rest of the reserve crown is perfectly healthy. It takes you a lot of time. The repulsions are not good. I really don't like the repulsions. Okay, they are just too aggressive. There is this new technique with the screw. Did you see the technique with the screw? That one works pretty well. I extract a couple of the teeth with that technique. For those who doesn't know, basically, we put like a trocharter through the cheeks. We make a small hole with a drill on the tooth, like 5 millimeters. Then we manually made the way to the screw. There is a long screw that it's attached to the tooth. At the end is like a big piece of metal, and with the head of the hammer, we just bang and the tooth is out. It's less aggressive than doing repulsion. Okay?
So you go up that way,
Like this.
with the screw over that way.
Like this, you put a trocharter, and then you turn and you work on 45 degrees. It works, it really works. Okay, let's...
Same thing as the spinal flat technique that you're describing or different?
Like what, sorry?
A spinal flat technique, like when would we indicate to do a spinal flat extraction instead?
What you call a spinal flap.
When you make a flap in like the frontal sinus or the conchal sinus and you're extracting the tooth.
Okay,
that
that's a
way.
repulsion. Okay, but usually you don't, to a repulsion, you don't do a flap.
Oh.
You know, working, she was asking me about the repulsion techniques doing flaps in the sinus, you know. A flap in the sinus is usually done, for example, to extract a cyst. For those cases with sinusitis, I do very small holes, like 4 millimeters, enough to put a serum system entering from one side and going out from the other side. And from that small hole, you can flush 20 liters of chlorhexidine if you want.
So you're breaking the cyst through that hole and then flushing.
No, if it's a cyst, you need to open. Of course, depends on the cases, you know. But for a repulsion, for example, you need to open a hole that the repulsion system will enter. You don't need to open it. You know, I always try to be conservative in the techniques. Okay, let's bring a donkey. So in a donkey, you can really keep the head up. This system is really nice because you can regulate very easily. And something goes wrong, you just do like this, and the animal is out. Okay, so it is a very good system. You can keep the head up. Of course, this is what helps me to keep the head up. Any of this equipment is mine, so I'm not actually used to work with this equipment. But if you use this, never have a closed hook. Leave it open, because if you need to release a fast animal, it's not the same just doing this or having to open it and to... Okay, so think always about your safety and animal safety. And of course, this is for horses. Anyway, you can take it here, but the animal can start going down or going back, and you want to remove it. With this system, you cannot. Okay, so and the one I use for horses, instead of this, just as a rope with a piece of hose. So it is very easy to remove. This is huge for these little donkeys. Okay, so you will see that this specific piece of equipment is not effective for these donkeys. We'll try to do it. We have drugs here. If we need to sedate the animal, we sedate an animal, and it's not a problem. This one, that's another system, but it's even bigger. So, you know, try to. Of course, you have to adapt. You have to adapt what we have here. Let's try to do it, and we'll see. It was the smallest donkey. My dog was bigger than this donkey. Easy. You see, donkeys, they are very curious. This animal is not curious at all. You can see by the reaction, you know. When you work with these animals, and you know, doesn't matter if it's this size or this size, the body expressions are pretty much the same. This animal is not comfortable at all. It's completely stressed. You can see by the ears, you know. When they are like that, you know, he's not curious at all. So it starts telling me that probably this animal will react. Okay, it's 80 kilos donkey. So even if you keep the donkey in your arms, good boy, come here, come, easy. He's really, you see? He's not used at all to someone to touch. Look what he's doing with her hand. You see the animal? Every time I touch the animal, he's doing exactly what they do to escape. Move the hand down. So it's like, okay, I'm ready. If I have to escape, I go like that. Okay? Easy. You see? He complains a little bit on this side and here too. You see? What I have to do, for example, I move here. I'm pressing here and I have no reaction. You see? No reaction. I go exactly to the same area where this ring is. I press and I have a painful reaction. So it tells me that probably this animal, he has the upper cheek teeth are sharp. Okay? Probably they are not, but usually there is a direct relation between a painful reaction and the animal is feeling pain. And the EMG is a little bit sore, but not that much. And here we don't have. Especially with this IOS test, you have to do it like fast and release it, because if you do it 2 or 3 times, they learn fast. And before you touch, they already move the tongue apart, so you don't feel anything. So while doing this, what I do, I literally break the head in 2 pieces and I look for symmetry, okay? So like just touching the animal, you can try to understand if they are symmetric. For example, this is a young animal. And you tell me. Come close and. No, a little bit older. So the central ones are already, he changed the central ones. That is, the rule is 2.5, 3.5, 4.5, okay? So, but in donkeys, it will be like 3 to 4 months later. So he's somewhere between 3 and 4. Okay, because he already changed, between 3.5 and 4.5, okay? He's really, really, really scared, okay? But, okay, easy, come here, easy. Come on. Okay, let's flush the mouth. When working with electric tools, try not to have water all around you, okay? Easy. You see, it's happening a little bit.
Yeah.
You see the nostrils?
Stand over there. I don't want him to back right in.
It was just a little bit. It was nothing like, but it's happening a little bit. So in this case, this is when you need to release the animal. You know? He was with water in the mouth, not breathing, not swallowing, and now it's starting. It's like.
So maybe they're trying to protect themselves from drowning?
Something like it's a friend of mine who is a doctor. He said it is exactly this rostral movement of the palatopharyngeal arch is exactly what babies do when you put them in the water. So it's exactly what's happening. So in this specific case, you just need to release the animal, and if something is happening, you just massage a little bit, allow them to swallow, and that's it. And the vast majority of animals, it's when they really feel like it's the worst thing that happens during the entire dental treatment. But if you are not aware of that, so she was trying to move the animal forward with the mouth full of water and not breathing. So just release, and in the exact moment we release the animal, he did like this. Okay, there we are. And it is very important to take a fast look of the bucket is also nice because of the content. Because sometimes, usually, if the animal is complaining more from the right side, I flush first the left one. So after one entire flush, if it's still coming out water out of the right side, it tells me that he was packing food in there, okay? So let's try to find a gag that fits you, my friend, because so small. Let's try to bring the animal Here I really, well, let's try to put the animal inside. Come on, come with me. Come with me. This way, now this way, come. Come on, easy. Come on, there we are. Oop. Okay, let's go from outside. Isn't a problem? Come on. He's really scared. Take him here. Take a hair from him. This is really big for a... Easy. Move him in forward. There you go. Up. Easy. Up. There we are. Up. Easy. Here. You see, there's no point to keep this animal inside the inside the stove. But it's just because the engine is there. There's literally no point to keep the animal inside because it's just too small. But easy. Move it forward. There we are. Good boy. I have to tell you that I never treat such a small animal. I don't know exactly what to do with such a small head.
It's all the same, just small.
Okay, good boy. And the most important thing now is, if we're not going to sedate the animal, I always have to be in contact with him. There's no point to leave the animal with the gag on, especially big animals, in between metal bars, unattended. Okay, that's why if you need, for example, to go and wash your equipment, always close the gag, because it is very easy for the animal to move, to crash with the jaw against this with the open mouth, and you went for a routine dental care and then you end up with a fracture of the jaw. And now explain the owner that it was your fault. Easy. Okay. Easy. So small. How big is that? How big is that for you? How big is that? Easy. Jesus. Easy. No. Yes. So, is there anyone smaller than this? You see, look, it's.
This is the biggest I've been.
Would you like me to go get a standard size dog?
Yes, please. It would be okay. Yes. A standard one would be perfect. And the nice thing is when you have to work, usually they can stay very comfortable like this, you know. To escape, they will try. Of course, I'm explaining you things and I'm losing precious time. It really doesn't matter if at the end we'll treat the animal or not. It's just for you. Usually when you do this, the animals, they stay. And the nice thing is, like, if you have to do 10 a day, the person who is working with you, the shoulder, keeping the shoulder, and usually you have the owner to keep the shoulder. I don't want the owner here. I want the owner here to see the dental problems of their animals. So with the farrier work, they can see before and after, not inside the mouth. So I really want to see the owner to see, to feel, to touch. Okay. So what you see, even if the animal releases, let's see how he reacts. See, they stay like that. You cannot keep the head of an animal like this if the animal is sedated. You know, so, and if the animal starts fighting with me, you just pull the rope and the animal is out. Okay? Good boy. 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 I think I always find better if no one is touching the animal. Okay? Otherwise, he will fighting against me and against you. So I prefer him to fight only against me. Easy, easy. 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 Where are you going? It's really, really, really small donkey. But please, if you come close and see this hook here, do you see this hook in the front? Yeah. So this hook, we can reduce him from straight away, okay? This small hook here, the upper six, okay? But look how effective these tools can be. Come close to see if you want. Yeah. Look. Gone. Look, completely gone. You see? So imagine how dangerous this equipment can be in the hands of someone who doesn't know how to work with.
But you could also do it with the regular tools, right? It takes a little bit more time. But
Manually, of course you can. Of course you can. Of course. I made thousands of manually, working manually. Good boy. And you see, for example, this is not good. We don't want something doing a shadow in front of the eye. You see? Good boy. Good boy. Good boy. And literally they can stay like that. For example, if you are doing an extraction or something like that. Not with the extraction, of course, the animal is sedated, but this technique is if the animal was sedated, the head should be here, okay? This is the normal position. And even during the extractions, the animal, they just rest like that. And it is very good, you know? But you see, the animal is not moving. This is the normal position. When you keep the head up, donkeys stay like that with this system, okay? No, no. Especially because he's not sedated. He feels the electric.
You.
Breathing. You see?
Do you worry about yourself?
Yes. At home I use with a mask and glasses.
Thank you. I was hoping. Just wondering.
Yep. I always use the glasses and the mask. The mask not always, I have to be honest. The glasses always.
Why the glasses? Because the mask is more the
Because when you put the glasses because of the cornea, you know, they can, some huge conjunctivitis. But using the mask and breathing, usually you cannot see.
Yeah, I know. Fog's terrible.
Yeah. So I protect the eyes, but not the mouth. I have to be honest. I know. I know. And I'm not a smoker, but I'm. And the nice thing about this system is that if you want to check the incisors later without moving the head of the animal down, you just remove. Of course, this one is too small and is going to move out, but you can remove this without removing the. So it allows you. He's going out. Easy. It allows you to check. It allows you to check the incisors, you know. But when using these systems, please be sure that everything you need to release, you can release fast, okay? That's something very important. For example, this animal, you can feel the bumps, you can feel the eruption, you can feel in the mandible the eruption of the definitive tooth, okay? If you touch here, come and touch. Here, on both sides. It tells me that even without seeing the teeth, it tells me that the animal is young, okay? Can you feel it?
What am I feeling?
Can you feel the mandible? So basically, that's the bone that is inflamed by the fact that the definitive teeth are start erupting. Here. There. You feel it?
Yes.
Oh, yeah.
Yep. Can you feel it? And usually, it tells me that these teeth are under the eruption process. So it was the first thing I felt, and the first thing I looked, it was for retained caps. They were not here, okay. In my study, I only found in 6-point-something% of the cases with bumps the retained teeth. But anyway, okay, go. But anyway, it's important to check, okay. I just want to show you that sound that I told you that I always do to check. Hey. And when working with donkeys, you realize that the animal was like a little bit agitated just because she was here. So the best thing to do with donkeys is leave them, He's like that. If you don't touch in any other side, because he's paying attention on me. So he's trying to move back. But at the same time, there is a barrier here, so he's trying to move forward. And when the donkey feels that it's like being cut, is when they go mad. So the animal needs to be, when the animal was the head like that, the animal was relaxed. Otherwise, he would start fighting with me. So they always try to escape, all of them. They try once, they try twice, and they say, okay, if I cannot escape, I'm not going. They are not wasters of energy. They try once, they try twice. If they escape on the first try, they escape on the second, on the third, because you are not going to be able to keep them. That's why I'm always controlling the head, always. And the nice thing about this procedure is that if at the end the animal is agitated and I am not done with the modern drugs, in 2 minutes I will have the donkey completely sedated. What is important in here is don't stress the animals. If you remember from the physiology, the alpha-2 agonists will occupy the same receptors the adrenaline does. So if the animal is stressed, the receptors are occupied by the adrenaline, you can give the doses you want. Probably we'll finish with a paralytic ileus first before the sedation. So it's literally a question of working with the animals on a very relaxed way, While I was doing the clinical examination, the external clinical examination, I was in contact with the animal, establishing a link. And again, if I feel the owner is important for these situations to be next to me, I'll call the owner. Otherwise, I try to have usually in these kind of situations, as the Aquitarian, these kind of workshops, if you don't talk with the owner suddenly disappears. You have to be looking after the owner when you finish. Say, who is this donkey? So, okay, let's listen to. Come here. Come here. See? Easy. Did you listen to that? That means there is a full contact between the upper and lower. Because it's a young animal, it was just balanced a little bit. Okay. Can you open the door for me, please? Yeah. Out. Out. Come on. Come on. Come on. Up. Out. 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 Good boy. Good boy. Good boy. Good boy. Good boy. Good boy. Let's try to flush the mouth in here. You see the reaction already? He's trying to escape. We didn't start yet and he's trying to escape. No. He didn't like to be outside 10 minutes alone. Those animals are, look, he's trying to escape, you see? We didn't do anything and the animal is already trying to escape. So this is the kind of animals that before starting, he's telling that he will give me trouble working.
Give you trouble? Well, and his buddy's outside, but he's
You see?
away from us too,
So
so.
bring the friend in.
You want the friend in?
Yep. If there's those animals, they establish links. If there is a friend outside, let's bring the friend inside. So I'm avoiding the stress situation in here and the stress situation out there. Because probably the friend is behaving exactly the same outside. I usually start working with animals when they are 2.5. So
You were saying earlier about seeing a lot of disease and
preventing the acquired disorders, you know? And of course, in some extreme cases of overjet, well, overbite, you can have small hooks even in the milk teeth. So you just rasp them a little bit. You see. Look, you see? You see how they close the nostril? Not that much, but a little bit. There we are. There we are. Easy, easy. Easy. Come here. You see? Look. Look how he's reacting. So this is the time, release him. This is time to leave him alone. Wait those 10 or 15 seconds. And if they're not start breathing, you just do something like this. Not yet. And there we go. And he starts now. What he does with the front legs, some of them, they really try to jump on you. Because that is a very aggressive situation. When you flush the mouth, they just contract the soft palate and they move forward the palatopharyngeal arch. So it's like they stop breathing. It's like they are drowning. Good boy. Good boy. Come here. Very easy. He's complaining more from this side, you see? Not that much from this side. Okay, come in. Come in. Come in, come in. Good boy. Whoop. There we are. Easy. Easy. Okay, you go out. I told you. They are. It's once you learn how to work with them, even before starting, they will tell you if they are going to be cooperative or not.
Yeah.
Come. Easy. Easy. I always try to keep the head collar on the neck. Easy. It's okay. You know what? Use this, press the palate, and they will all open the mouth. That's why it's designed like that.
So you can reach in. I just lower their head.
Press the palate. Doesn't matter if it's a cat, a crocodile, or an elephant.
Yeah.
All the animals, if you press the palate, they will open the mouth. Easy. Come on. You see? Literally trying to escape. Moving the head down. You see? I'm pressing the palate, and the mouth is open. You see? Those are the small tricks you learn. You see, that's why this system is not nice. Now I have to release this to put back in place. When working with this system, just be sure that it will not stay at this level because it can close the gag. Okay? Up. Time to close the door. Up. And this one too. Just like that. Good boy. Good boy. Can you come a second? Even if you leave the animal and tell it like this, it is not a problem. Except if you leave with the open mouth, they can crash here. Just keep the animal like this for a second. Where is my headlight? And this is twisted.
That's what I'm talking about, opening it like that. Press it out then too.
I don't know. I press to open. Of course, if you go down, it's easier. And do it at the very end. If you try to open here, it's much more difficult than if you open it. Now what? Easy. Easy. If you look, this animal has sharp edges, 2 small hooks in the front, and 2 small ramps in the back. The ramps in the back, you barely can see them. You feel them, but these hooks, you can perfectly see them. You see? Here? Okay. If someone wants to feel, please come. Put your fingers like that. Leave the tongue in the middle. Go until the very end and feel both lower arcades at the same time. That's the way I do it to see if they are symmetrical and rough. Go from the back, feeling both. It's not the same feeling both at the same time or doing left and right. Coming like that, if something is irregular, you feel it. In the upper is more difficult because your fingers don't allow it. You can do it like that. Okay? If you put your hand in water, it's much easier. So it's just, but this is the face they do when they are like that. You see? Like he's paying attention on me and also trying to understand what's going on in the back. Okay? This is the normal behavior of a donkey without sedation doing dentistry. I will close a little bit. Okay. So if you do that in the lowers, it took me 5 seconds. It's enough. Because I'm seeing what I'm doing. I just go to the back. I can control with the foot pedal. You do it very fast, like boom, and that's it. It's better to do it fast coming out instead of boom, boom, boom. You go to the back and you're like boom, and that's it. Okay? Much, much, much easier. Some of them, they don't have the foot pedal. Doesn't matter because they are traumatic. You can go inside and do it, okay? This system is much better because if you have to work with a power float, you need 2 hands, so you cannot control the head of the animal. The trick is to keep my hand in here, so. Yay.
What kind of wheel do you use on that?
That's a diamond disc.
Do you recommend that?
When you start working on a certain level, you will see that all the equipments are more or less the same price. It's not better than others, it's yours. You know, I'm always trying to understand where should I turn on the light, and because it's not my equipment, you know. I'm always going to the place where mine used to be, so. And be sure that it's always symmetrical. If you keep 3 on one side, 2 on the other side, they really don't like that. Because they feel the pressure and they start fighting with me. Good boy. Good boy. You are a good boy. For those who work manually, it is more difficult because to work manually, you need the head down. So you lose this capacity to keep the head. For those who work with electric tools, you really need to keep the head like this. So you need to see it. Easy. Last one. There we are. Easy. No, don't worry. There we are. Good boy. Good boy. Good boy. Good boy. Good boy. That's easy. I would say, first, I only look really, I try to have the entire information, like checking the mandible, but the infundibulum is, in some donkeys, I saw donkeys with 30 years old still having the infundibulum. So it can be much deeper in donkeys. So I always pay attention to the shape, the transversal shape of the teeth. So this animal, for example, the central incisors are triangular, but the second ones are not that triangular. But if you look and in some donkeys, you will see the third incisor always as a half moon. It will never close. This animal is probably 15, and if you see the third incisor, it seems that it just came out. You see? So you can never, usually you cannot rely on the third incisor. So by the shape of these teeth, easy. Because we have the central incisors triangular, and the second incisors getting triangular, I would say 14 to 15 years, not more than that. But if the owners don't ask, don't tell them, because the chance that you'll be wrong, it's huge. So,
So they get triangular with age, you're saying?
sorry?
They get triangular with age, you're saying?
Wait a second, let me just finish on the west. Hey! Well, you've been very cooperative, to be honest with you. Just want to remove a little bit of the calculus that is here, but I don't have anything actually to remove, so. Nope. Easy. I think we're going to stay with the calculus. Easy. Okay. You had enough, I know. Let's move you out and remove that outside. Perfect. No problem. No problem. Easy. Okay. There we go. And then he escapes, you see? It's exactly what they do to escape. They move the head down and escape, you see? As soon as I release the head, boom. And I had him with me for 10 to 15 minutes, and he was there, waiting for the first opportunity to escape. As soon as we release the head, boom. So basically, the only trick to allow to work with these animals basically is to keep the head up. If you do that, and you never leave them unattempted, no problem. It's their way of escaping. A horse will jump. They try to move down. It's their natural way of escaping. We just saw it. There we are. Look, all the calculus, you see? All the calculus coming out? And there is already, look, and there is already periodontal disease surrounding, you see? You see how it's bleeding? So when removing the calculus, always do it from outside. That way, I am sure that the blood that is in there is because the gum was sensible because of the calculus, not because I was digging inside. Easy. And it's very, as I told you, periodontal disease, it is very painful, so he's complaining. Okay, time to go. Easy. What about if I keep it like that? Are you going to fight with me? Or are you going to allow me to work? Huh? What are you going to do? Huh? Do I have a donkey to work with? Let's try. There we are. There we are. Good. But you see the difference of if you work with animals that are usually handled by the owners, you don't need to have this.
Yeah.
The thing is, if it's a horse and is not handled, probably you're not even able to sedate the animal because he will not allow you to go close. When the animal tries to enter, because it's a donkey, I stop him with my chest. If it's a horse, I'll be there on the other room. So, yep. Because it was a mini, I stay on my knees in front of the animal. It was a horse, no way. Even in these very stressful situations, you see, once you put the animal like that, they stay. You know, he's trying to fight with me. I told you he's not going to be a good candidate to try like that. Okay. He's really, really, really scared, you see? Yeah, but there's no point to work with this.
Yeah.
You know. And there's always another day. You know, if it was my client and I come and the animal was like that because of something, I will not even charge the client to say, I'll come tomorrow. You know, because at the end I will need. Of course I can do it. You know, of course, I have the animal inside for 5 minutes while I was talking with you, explaining things. If I'm alone, of course you can do it. You know. Of course, you know, if I'm alone, I just put the guy on.
We all like went on his mouth to look. He's like,
The,